Welcome back to LIMBWatch, where we bring the innovators, clinicians, and industry leaders helping shape the future of limb preservation, diabetic foot care, and wound healing. Today, I'm joined by Riley Csernica. Riley Csernica is the Vice President of Product Development at DARCO International. She leads product strategy and innovation initiatives focused on improving patient outcomes, enhancing clinician experience, and driving financial efficiency in diabetic wound care and podiatry clinics. Prior to joining DARCO, she held product management roles in medical bracing and hospital capital equipment sectors. Riley earned both of her Bachelor's of Science and Master's of Science degrees in bioengineering, as well as an MBA in entrepreneurship and innovation from Clemson University. So, welcome back, Riley.
Thank you so much, Dr. Hutchinson. I appreciate you having me.
Thank you. So, for many of us clinicians, we know the name DARCO, but not everybody knows the story behind it. Can you take us back to the beginning and tell us how DARCO was founded and what problem it was trying to solve, and how the company was started by a podiatrist and grew into a global leader in foot and ankle care?
Yes, of course. So, right, DARCO is definitely not a new company. We were founded in 1985 by a podiatrist, Dr. Darby. At that time, Dr. Darby was a practicing physician and dealt with a lot of patients every day in his practice who were often frustrated and complained to him about wooden post-op shoes, which is how they used to be made back in 1980s.
Oh,
And
wow.
Dr. Darby, yeah, but Dr. Darby was a true entrepreneur and innovator at heart. So rather than complaining alongside with his patients and allowing everyone to be frustrated, he was motivated to actually do something about it. So Dr. Darby actually took a look at running shoes of the time and found inspiration in the running footwear industry and thought, why can't we pull some of the elements of running footwear and implement them into medical footwear and see if we can balance the rigidity needed for medical situations, but doing it in a way that's more comfortable and would create a better experience for his patients. So on literally on a napkin on an airplane, Dr. Darby sketched the world's first semi-rigid post-op shoe, trying to have that prototype made. And when he brought it back, it definitely took a lot of convincing and changing hearts and minds for helping the industry realize there's another way to approach post-op shoes. But eventually, we were able to grow our business into Darco today, and we're responsible for developing the modern post-op shoe that you would use in your clinic today. So it's very exciting to be a part of a company that has such a history of entrepreneurship and innovation and putting the needs of patients first and not being restricted by the way we do things and recognizing that there's always a better way.
Oh, wow, that's actually incredible. I did not know that, and that's quite fascinating that he, like, went against the grain and was able to convince everybody as well as show that this works, and now it is, like, our gold standard pretty much.
It it is. It's pretty cool to work for the company that developed, what essentially became like the Kleenex of our industry, right? Everyone knows
Yeah.
what post-op everyone has one, but
Yeah,
that had to start from somewhere, and it started at Darko.
that's incredible. So, can you tell us what inspired Zarko to develop the Go line?
Right. So we're really excited, Darko being in business for over 40 years. We're always looking to innovate and figure out what the next trend and need is in our industry. And so we're leveraging our experience in the post-op industry, but moving more heavily into diabetic foot care. And I think if you work with diabetic patients now, you might have be familiar with the challenge that can often occur in the exam room over adherence, right, to
Uh-huh.
the footwear that's being prescribed to patients for diabetic offloading. A lot of times, the devices that we use for offloading might be cumbersome to patients or difficult for them to return to activity in daily life. So, what Darco is driven to do with our Go line is develop a series of products that drive adherence but still allow clinicians to give appropriate levels of offloading to the patient. So that way, patients and clinicians no longer have to choose between offloading and clinical efficacy and what is suitable for a patient when they return to their daily life post care.
Oh, okay. So what makes AirCore different than traditional diabetic insoles of PEG assist systems.
Right. So in our DARCO GO line, we're really proud to feature AirCore as one of two key technologies that are threaded in our line. And AirCore is a new type of material that was first used primarily in the running industry in high performance running shoes. And what we're doing is being inspired by developments in running and bringing them into the healthcare sector. So with our AirCore material, that is serving as our primary offloading technology. Maybe if you're familiar with Darco and used our products before, you're familiar with the Pegasus offloading systems. Those insoles were first developed for more of a post-op short-term use application, but we realized more and more with our product being used for diabetic wound care that we needed to upgrade our materials to allow them to provide the longevity needed for a diabetic care situation, right? A lot of times diabetic patients need several months to heal, not several weeks. And so
Uh-huh.
therefore having insoles with materials that can hold up for that length of time is really, really important to success of the healing of that patient. And with our AirCore materials, we're able to deliver that performance now better than ever before.
Oh, wow. So when it comes to AirCore, so it was developed from athletic material, correct?
Yes, correct.
Okay. Yeah, because a lot of our diabetic patients, I mean, they are very much on their feet a lot, and a lot of people can't stop working, so that's incredible. So how does rebound super foam technology benefit diabetic feet?
Right. So using high rebound foams like our Air Core material really support longevity and maintained offloading performance over the entire course of healing. So we're able to use these new technologies and implement them in our shoes so that way patients and clinicians don't have to replace a shoe or an insole over the course of treatment, or at the very least get a much, much longer life out of that and reduce the number of times a product would need to be replaced. So this is creating financial efficiency for the patient, clinician, and maybe healthcare system that's paying for these products. So it's really important to us to make sure that we're designing for the diabetic patient situation, which often requires, months, not weeks of care for an episode.
Oh, wow. Just on a side note, I'm sure I told Molly before, but the reason I like Darko so much is because in the previous past with my patients, and a lot of our patients that I go with in underserved communities, so when they get a post-op shoe, they can't just buy a new one. And this is not their first rodeo with a diabetic ulcer. And when my patients can't afford it, right, they'll be like, oh, I can bring back my old post-op shoe, right? And
Mhm.
whenever it was a Darko shoe, it would be so good condition, like, still rigid, not flexible, not floppy, and I'll be like, "Wow," like, that's why I was like, "Oh, Darko is if you want to have it for a while, for a long time, and something that is reusable, yeah, Darko shoe gear."
Well, thanks so much. I'm so excited to hear that feedback. Again, we really try to focus on longevity and quality in all of our designs. So it's wonderful to hear that. Right to your point, money is definitely a factor that we need to consider for patients, but also access to care. A lot of
Mhm,
patients maybe live in rural settings, and while we would love for them, if they have an active wound or situation, to be able to visit a clinician maybe once a week, for some people, that's not necessarily as attainable or practical because they live far away from their care provider or maybe don't have the means of transportation to get to those appointments on a routine basis, which therefore makes that shoe all that more important when they do get the opportunity to come visit you and,
mhm,
and get time under your care, that whatever they're sent out in, we have the confidence it's going to be able to last them as long as possible and give them the longest amount of time of quality care and
yeah,
performance as needed for those reasons as well.
uh, how easy is it to customize the offloading with the Air Core insole?
Very easy. It can be achieved in a clinic in just a few minutes' time by a doctor or podiatrist. But something that we've noticed recently is some of the clinicians are actually training other members of their staff to be able to do the offloading as well. So maybe it's a cast tech or an orthotist or a nursing staff member. So because of the ease and the accessibility of doing that offloading, it really opens up the number of types of clinicians that can support the offloading process, which is really, really helpful with healthcare systems often being oversubscribed with patients and care volume. The faster and more efficiently that we're able to provide effective offloading, and the number of clinicians in a practice that are able to have a hand in providing that type of patient care, the better it is for all.
Okay. And so what are power pods and how do they differ from traditional walker outsole designs?
Right. So PowerPods is the second technology that underlines our Go line. And this is really more focused on gait optimization. So when it comes to designing for diabetic patients, we oftentimes think about offloading performance, making sure that they'll be able to get efficient pressure reduction to close a wound. But the other piece of it that we always need to think about is gait stability, right? It's not enough if a product offloads well if the patient can't walk in it safely. And that's what power pods are designed to do. So with a lot of other walkers, they're typically constructed by layering and gluing different materials together in the footbed to create the sole combination. But sometimes by gluing all those materials together, you end up with a very thick sole that will be of a much higher height than the shoe on the other foot. And just research shows, 5 to 10 millimeters of leg length discrepancy between the two
Mm-hmm.
limbs is enough to cause imbalance or hip pain that maybe the patient didn't have prior to treatment. So rather than thinking about how or working with products that create such leg length discrepancy, Darco was thinking, well, what can we do to lower the height of the footwear that's being used on the foot undergoing DFU treatment? And that's where power pods come in. So rather than doing a traditional layered sole construction, what we've done is injected foam through a walker frame. And what this does is consolidates the outsole and midsole of the footwear, allowing us to provide all of the same elements and functions of the sole of a walker, but doing it in a much more confined space. So that allows the patient that's wearing it to have much better balance between the two legs, making them feel more comfortable and being able to walk safely during their offloading treatment, which is a really important driver of treatment adherence. And so that's really the motivation behind that design.
Okay. You mentioned that even millimeters matter when it comes to gait. How does matching the stack height of the everyday athletic shoe help patients?
Yeah, so exactly. Research shows that just 5 to 10 millimeters of leg length discrepancy is enough to cause issues in a patient during treatment. And so, therefore, it's really, really important to be able to do what you can to balance leg length height. Sometimes we see people achieve this by adding a shoe balancer on the other foot. So, it's another
Mm-hmm.
medical product to lift up the leg. But the challenge with that is that sometimes that can be a little cumbersome for the patient and a little unnatural to have to wear these two devices on the foot. And also it's added cost, right? Not only do you have to buy a walker, you've got to buy another product for the other foot. But by being able to drop that height by
Mm-hmm.
using a Darco walker, we're still able to achieve that balance that's needed for patient safety, but doing it in a much more cost efficient way.
Oh wow, that's incredible. Why is it important to think beyond interventional care when treating diabetic foot patients?
Right. So, you know, as a clinician, maybe at best case scenario, you have an hour with a patient during an appointment. But when
Oh
that
no.
patient leaves your clinic, I think that's
Yeah, yeah. That's a utopia world. Like,
and dangerous. We hear clinicians that have 5 minutes, right, with a patient.
yeah.
Right. But the reality is there's 168 hours in a week. And if you
Mhm.
get 5 minutes with the patient, that leaves the patient with 167 hours and 55 minutes to do what they want when they're not under your care. And we all know as clinicians and representatives in the wound care space that offloading is perhaps one of the most important interventions that a
It is.
clinician can provide their patient during treatment. You can
Mhm.
do all the skin grafts and hyperbaric oxygen treatments and wound negative pressure wound therapy that you want. But if you send that patient out of your clinic with a product that does not provide effective offloading, it's almost like adding sandpaper to that wound, right? When
Mhm.
they go home to their healing. So being able to think past the intervention that you're going to provide in the clinic and think about that transitional footwear that you're going to put on that patient when they leave your clinic and go out into the world. And it's so important to be able to maintain healing efficiency and to not undo the work that was done during your treatment session with that patient. And DARCO recognizes this, which is why we are so passionate about leveraging our knowledge in medical footwear to create a specialized line of products that's specifically targeting diabetic patients and the need for effective offloading footwear that patients are willing to wear.
Okay. That's so interesting when you said that because it seems like this Darko shoe line is kind of solving the paradox that a lot of us have to deal with where we tell patients to offload and stay off the foot, but yet our patients also still need to walk so that they can maintain their mobility as well as, let's say they have microvascular disease or PAD and they need to create collaterals, right? And they might be in an exercise program, things like that. So it was always a paradox for because we're like, stay off of it, but you need to move still too. So it
Correct.
seems Darko is addressing that paradox that we've been dealing with for years.
Correct. And it's a really wonderful point, and it is true. Is we shouldn't have to choose between your your wound health and your vascular health. But
Mhm.
you're right. We oftentimes are putting position or patients in a really unfortunate choice. I mean, the other choice that we often put patients in is having to choose between, work and their care. A
Mhm.
lot of times if patients work in a setting that has specialized footwear that they need to wear, we've got to think about those situations too. And patients not only need to stay on their feet to be active and mobile, but a lot of times they need to do that just to be able to stay working and to be able to have health insurance and bring in the money needed to afford healthcare. So we don't think that that's a choice that any patient should have to make, and we don't want to have to put clinicians in a situation where they're putting that person in that situation. And hopefully, with Darko's focus on innovating offloading footwear, we can eliminate that having to be a struggle for clinicians and patients.
No, that's a really good point because when it comes to returning back to work for our patients, we need them to wear a certain type of shoe gear. They usually need a medical letter from us explaining that this is how what they need and this is how long they need it and what type of weight bearing they need, even after they're healed. So that'd be like really great if Darko Shoe Line became like a gold standard where you know for sure that this patient can be weight bearing on it and still be able to work. And I'm talking like after they heal, because after they heal, they still have to
Right.
be in the right shoe. So that'll be awesome.
Right.
Okay. So
For sure.
we're rolling in. I'm going to do our rapid fire section, if that's okay.
Okay.
Okay. So, what is the most underrated innovation in podiatry?
Offloading footwear.
Yeah. I just wish a lot of patients understood that. A lot of them love flip flops. You think Doctor will
Yes.
ever make some flip flops?
We think about it. Our engineering staff has always got the wheels turning of how we can give patients what they want in a way that clinicians will feel comfortable with. So I don't think that's an impossible achievement.
Yeah, I that would be super awesome. I believe definitely patients would love that. What's one word that describes Starco?
Uh, Advocate.
Oh, that's so nice. Really, that's amazing. I really love that. So,
Yeah.
what's the favorite part of product development?
For me, patient testimonials.
Oh, oh, that's so nice. It's just like empathy. It's just like people who are empathetic and like think about the patient. And so that's so nice, Riley. If you
Yeah.
could solve one diabetic foot problem tomorrow, what would that be?
Um, I don't know if this counts as a diabetic foot problem, but I would say streamlining the therapeutic shoe bill.
Okay.
Yeah. We often hear a lot of challenges in patients being able to get access to the preventative footwear they need because of the
Hmm.
complicated nature of that. If we could figure out how to streamline that to make it easier for clinicians and patients to get it, I think that would be awesome.
Yeah, that'd be great if it becomes part of a like guidelines, because the
Right.
whole point is to have prevention. So like it's just like everything needs to be planned out ahead before ulcer can even happen. Like the moment I keep on saying to people, the moment they say you have diabetes, let's get the ball rolling. Like
Right.
get the shoes, everything, you know?
Right.
So what do you think is the most underrated aspect of diabetic foot prevention?
I think that would be recognizing that it's a need for footwear to be practical for patients' daily life.
Yeah. I remember you were mentioning longevity, okay? And just
Mm.
from my experience, longevity, like, oh, I've seen patients have the Darko shoe, like the post-op shoe, for years and had multiple rounds of ulcers, and they still have like the same shoe. So when it comes to longevity, what is the expected for a Darko shoe from the line?
We would expect the performance, depending on the shoe, to be anywhere from 3 months, and then some of our shoes that are designed for the longest term would be, like, up to a year, if not longer.
That would be great. And what's one lesson with product development that has taught you about life?
Um, Talk less and listen more.
Oh, yeah. Mhm. I love it. You're just so nice, Riley. Okay, so we're pretty much done, and I thank you so much, Riley, for joining us and explaining literally the history of Darko Go Line and about just Darko, the company, amazing. I did not know that. I think that's fascinating. Now, whenever I think of Darko, I'm thinking of him drawing, like you said, on the plane. And I just think that's such a fascinating, like, it feels like it could be like a Netflix film. That's how I feel like maybe someday in the future.
Well, next time you're on an airplane, get your napkin out, and maybe you can come up with the next podiatry innovation too.
Oh,
Could happen.
we all have our talents. I don't think I'm like that. I don't think so. I wish I had the talent, but yeah, I don't think that's me. So when we talked about the history of Darko, the evolution of offloading, the challenges of product development, and the future technologies that will help protect feet, heal wounds, and ultimately prevent amputations. And what is clear is that every device, every design change, every innovation begins with a simple question: how can we improve the outcomes for patients? And then for those of us working in diabetic foot care, wound care, and limb salvage, we know that healing often depends on much more than what happens in the wound bed. It depends on pressure redistribution, patient adherence, mobility, protection, and giving tissues the support that they need to recover. And that's where thoughtful product development matters and makes a tremendous difference. And today, for our listeners, we hope that today's discussion provided valuable insight into science, strategy, and innovation that is happening behind the products that many of us, use every day. And if you enjoyed this episode of LIMBWatch, please be sure to subscribe, share with colleagues, and join us again in future discussions with leaders, innovators, change makers who are helping advance limb preservation all around the world. And big thank you to Riley. And I don't think anybody knows this, but if you follow, but Riley was my first ever guest on the podcast. And now she's like the first, second, the repeater. So I want to keep this role going. I think this is like a really positive sign. So I love it. I'm so grateful to Darko. I'm just a firm believer behind this line. Quality definitely over quantity. And I'm always rest assured. I'm never worried and staying up at night wondering if my patient's shoe broke down on them. So I really appreciate that. And until next time, remember every step matters, change, and thank you again.